Miliary tuberculosis, a case report. Miliary tuberculosis is the result of lymphomatogenic spread of Mycobacterium tuberculosis, which occurs in 20% of infected patients as an extrapulmonary manifestation. The central nervous system involvement has been reported in 30% of all cases. Gastrointestinal, particularly gastric involvement, is reported in only 0.03% to 0.21% of routine autopsies in patients with lymphomatogenic spread. We have the presentation of a 74-year-old male with history of diabetes, systemic arterial hypertension, and chronic heart disease who was admitted for symptoms of chronic headache, fever peaks, abdominal pain, and right side weakness. On physical examination, a cervical abscess was found with ipsilateral hemiparesis, and general poor nutritional status was observed. A brain MRI was performed, which showed multiple small lesions in both cerebral hemispheres, with perilesional edema, no mass effect. Image in panel A. Cerebrospinal fluid analysis showed hypoglucurrhea and hypoproteinorrhea. Adenosine deaminase was performed with a negative result. PCR for tuberculosis was negative, polycultures negative results. An abdominal CT scan was performed and showed a gastric wall thickening resembling neoplastic aspect. Endoscopy then showed a necrotic circumscribed lesion highly suspicious for malignancy. Biopsy was taken, image in panel B. The patient presented neurological deterioration requiring mechanical ventilation, continuing with fever despite broad-spectrum antibiotics treatment, unfortunately dying after 35 days of hospitalization. Then necropsy was performed that documented pulmonary, brain, kidney, liver, and gastric and medullary involvement of miliary tuberculosis. In conclusion, tuberculosis is a worldwide disease and a health problem in countries like Mexico. The mortality can be as high as 50% when there is gastric involvement in small series reports. The atypical presentation can confuse the clinician and delay the correct diagnosis and proper treatment. This diagnosis is only verified in most adult cases post-mortem, such as the case presented. Thank you.